am Tina Moreira, a rural health nurse working at Ladyville Health Center and previously at the San Narciso Health Center in Corozal District. Healthcare workers at all levels of care should receive regular in-service training for the management of the different programmatic areas. For example, the expanded program on immunization. The immunization program deals with forecasting the quantity of vaccines needed for the assigned target population, the management of cold chain equipment, the surveillance of vaccine-preventable diseases, and the investigation and reporting of potential outbreaks. We have benefited from the support received from UNICEF. Myself and other staff received training in the management of cold chain equipment and vaccine-preventable disease surveillance. The training reminded us of the importance of strict cold chain temperature monitoring for vaccines from the production to the administration to the individual. This entails temperature readings and recording at the storage facility and during outreach sessions. We have increased our knowledge in calculating vaccine needs for outreach session, how to pack vaccine carriers, how to read vaccine via monitors, how often refrigerators need cleaning, and how often to do maintenance of cold chain equipment. The trainings were made possible by the Ministry of Health with the support and funding by the people of Japan and UNICEF.